How did you first hear about End Brain Cancer Initiative?
Okay, so most people, I was just researching everything like crazy and came across that as one of the organizations. And so that's when I first learned of it. And then I found you again, and in a more personal way, when I was invited to share my story at one of your educational presentations. I started waking up, I had headaches that just wouldn't go away. And I was forgetting words. I was getting lost in the middle of a sentence. You know, a lot of symptoms that people generally have. And I was just chalking it up. I was worried I was getting Alzheimer's is really what was happening.
Yeah.
And we had this one thing going on at home that my husband would ask me a question and I would hear the question. I would understand it. It just, I wasn't making the connection that I should probably answer him. So what took me to the doctor though was, we work together. So we have a company and I fell asleep at my desk, which is not like me to do. Yeah. And he came right over and he knew that I wasn't right for a little bit. And we were just chalking it up to stress. And he's like, right now I'm taking you to the doctor. And so that's what I did. And luckily the doctor there sent me to the hospital. And that's when they did the scan. And the doctor there came back and said, you have a mass in your brain. And he showed me the picture of it. And he said, I called a neurosurgeon at a different hospital. It was about 45 minutes from where I lived. And he wants to see you right away. And that's where I thought to myself, okay, well, I guess I'll go home, get a good night's sleep, because I was just exhausted at that point. And next thing I know, the flight crew is there and I'm flying to the other hospital. So the following day, they did it first thing.
All right. And it was GBM specific, right? Mm-hmm. And then how did the surgery go?
I cannot say enough good things about my surgeon. And I know everybody says that because they just love their surgeon. But this one, he got everything he could possibly see and was just, he's so humble and kind. I was just shocked about how that went. And so, you know, he came in and he was sharing with me, you know, how he got everything he could possibly see, wanting to make sure that worked well.
Did they reserve any tumor tissue at all?
But I had some samples sent to Duke at one point in the beginning. And I know that there's still more of it around.
Did you ever get connected with any clinical trials or have you participated in any?
I did. So right after my surgery and right after my 6 weeks of radiation and chemo, then that's when I started really looking at different clinical trials. Okay. I talked to Dr. Friedman at Duke about it, and they didn't have anything for me at the time. And then my insurance is through University of Pittsburgh. And so that's where I was seeing the doctor there. And I had a parade of interns coming through to see what would be appropriate.
Yeah.
And there was one trial that they were doing. It was veliparib. And I got into it. I had all the markers for it. And so I don't know if I got the drug or not, but originally when I was thinking about trials, I wanted to make sure that I got the drug.
Yeah.
But then I just wrapped my head around it and gave it a little different perspective, thinking, you're going to have this treatment anyhow, why not take the chance that you will get the drug? So I did that, and when that was all done, all the 6 cycles of that, great. It's great. I've had it since September of 2018. So I've been on for over 3 years. I've had the chance to not really meet necessarily the developers of it, but at a function that I attended, they were talking about that and really interested in user feedback of what would make your life easier. Yep. And otherwise, you learn to live with it. It's something that you've got, you know what the responsibility is with it. how to
Right.
make it work. And anything that's cumbersome or difficult, you just figure out how to have it work for you.
Did you have any?
I had the surgery, and then I did the standard of care that pretty much everybody does. So I had
Okay.
radiation and the temozolomide, and I was doing the clinical trial at that same time. Oh, not yet, but I did the 6 weeks, I'm sorry, of the radiation and chemo. And then after my month break, right when I was going to start my monthly chemo type tablets, that's when I started the veliparib trial.
If you were to look at your life before you were diagnosed and look at your life after, what do you think the biggest shift is?
My appreciation of today is the biggest shift. So my life before, things were good. I was kind of living the dream, but now I'm still here living the dream. And so who's to know what tomorrow is going to bring? And so I just appreciate every day that I get, and I'm thankful for that.
Yeah. And how are you feeling just on a daily basis? How are you feeling?
On a daily basis, I'm fine. I know whenever I go for my appointments, they always ask me, how's your emotional state? And it's fine. And quite honestly, I remember when I was first diagnosed, I was talking to a lady that I'm friends with, and she said, "What is it they gave you for depression?" I just had to shake my head and think, should I be depressed? And it never occurred to me that I should be depressed, really. I was dealt this hand, and you just deal with it. You roll with it when you can. I've always been a positive person. And my surgeon, when he came into my room and to talk about how my surgery went, and he'd found me a complete wreck. And he said, "Well, I'll tell you, none of us knows how many days we have, but attitude is everything." And I'm like, "Okay, Sherry, that's the key here, keep the attitude and keep it in check and you'll be fine." So I went home and had my pity party, and then put an end to it, So I set a limit of how long I was going to feel sorry for myself. And then when I reached that limit, then I was done feeling sorry for myself and just back to doing what I needed to do. One of the biggest things I learned really was with the healthcare organizations. In addition to a great new vocabulary of medical and terms that I didn't have before, the one thing that I would always recommend for anyone working in this field is always, always, always make the patient feel like they have hope. To do your homework and look at all of the options and chat with the doctors about all of the options, because they don't necessarily come to you and share all of that. It would have been nice if I would have had, okay, choose from A, B, or C. And these are the benefits and the drawbacks. Most often, I think patients hear, well, this is what we're going to do. Most patients nod their head and say, oh, okay. And that's what everybody does.
They're so emotionally drained at that point, really.
Right. If something comes up, I'm going to research it. I'm active in a lot of the Facebook groups for GBM. So I'm in the Survivors to Thrivers group. I'm in the GBM support group. My nature is that if something happens to me, I'm going out to find like people, part of them, or share my experiences with them.
From your perspective, what does a day like GBM Awareness Day mean to you?
What that means to me is that it's a perfect day to explain to people what GBM really entails and how they can react and help make others' lives better, as well as a number of other folks. And so I think it's just important to get it out there, because I've heard of it before, but I didn't realize the devastation of it.
Yeah, and I think that's why stories like yours are so important to just get out there, so people become more aware.
It is important, and I wish I had known more about it before I was involved personally with it.
Right.
but it's kind of funny because right after I was, seemed everybody knew someone, because it's really a very small percentage of the population that gets it, but a lot of people had a story. My daughter had a son, and she'd actually just had her second baby when I was diagnosed. So he was only a few weeks old when I had surgery.
wow.
So it was, but her attitude is a lot like mine. It's things happen, and you just deal with it when it does. Other than just, I saw the little clips of the Did You Knows, and I think I'm going to be using some of those as far as education. With my own personal Facebook account, people that know me know exactly what my story is. So I think I'm going to be a little bit stronger in my advocacy.